Thank you all so much for joining us for our September Town Hall. We're so grateful to see so many of you joining us today from truly all over the world and to see so many members of our amazing community come together. We've got families on the line, we've got supporters. I know there's some industry folks and people from the medical and research communities as well. So, a big welcome to everybody. For this month's town hall, we're here to learn about DeFi and a really exciting phase 3 clinical trial taking place to evaluate DeFi as a potential treatment to heal dystrophic EB wounds. We're incredibly honored to be hosting this town hall in partnership with Castle Creek Biosciences, and we're so grateful to their whole team for everything that they do to support and make a difference for this community. Today, we're honored to be joined by representation from Castle Creek, as well as a dedicated EB patient ambassador. You'll hear from Alicia Stewart-Smith on her experience with DeFi and what it really means to be a patient on this clinical trial. And you'll hear from Dr. David Chu on the science behind DeFi, how it's administered, the process and purpose of the phase 3 clinical trial, and how to participate. To provide a bit of an overview of our format today, as always, we will have a dedicated Q&A session towards the end of the presentation. But if any questions for Dr. David Chu come up while he's presenting, just feel free to raise your virtual Zoom hand. He's happy to take any questions as they come up, and we just hope that this can be a conversation. When we do get to that dedicated Q&A session, we'll, as always, prioritize the questions that were pre-submitted when you all registered, and then we'll do our best to answer any follow-up questions from the chat afterwards. If we run out of any time, anything not answered from the chat will be answered directly via email in a personal follow-up from our team. So don't hold back. Feel free to keep those questions coming. Before I pass it over to our incredible speakers, I just wanted to start with a bit of context on why we're here today and give some background on EBRP for any new faces in the crowd. EBRP is the largest global nonprofit dedicated to funding research to accelerate treatments and ultimately find a cure for EB as quickly as possible. We also believe that the science that we fund and the innovative venture philanthropy model through which we fund can be scaled to build a blueprint for the 400 million people around the world living with a rare disease. And since our inception, we've made a lot of progress towards that goal. We've raised over $70 million to fund more than 160 innovative EB research projects. And through the acceleration of those projects, we've helped transform the EB landscape from 2 clinical trials when we started to now over 50, from 0 treatments to 3 FDA-approved treatments just in the past 2 years alone. All of this momentum is, of course, really exciting, and it would not be possible without so many of you on this call today, truly. But these milestones are just that. They're stepping stones on our journey to a cure. To achieve our ultimate goal, we need to continue to fund and accelerate the most promising EB research around the world. Last year, EBRP funded 18 impactful projects across 6 countries, totaling $5.6 million awarded. And these projects span all EB subtypes, and they include a variety of unique approaches from gene therapies to skin organoids to squamous cell carcinoma treatments to exon skipping, drug repurposing, and iPS stem cell editing. And this year, we want to reach even bigger milestones to build off of the momentum that you've helped us create. Our scientific advisory board is currently evaluating 27 research projects, totaling over $8 million in asks, and as always, it will be our goal to fund as many of those impactful projects as possible. And we'll talk a little bit towards the end about how you can help us out there. We're honored to partner with companies like Castle Creek that share our mission and are committed to delivering real impact for the EB community. And we're especially proud to have been early investors in their FCX-007 therapeutic, now of course known as DeFi. Under our venture philanthropy model, we actually first partnered with the FiberCell team to advance this innovative therapy, and it's so wonderful now to see it in the hands of Castle Creek and to have them carrying it forward to the patients who need it most. It is now my pleasure to introduce you to our amazing speakers today. We're honored to be joined firstly by Alicia Stewart-Smith, a selfless leader in the EB community. Alicia likes to say that living with recessive dystrophic EB has not defined her, but instead strengthened her spirit and deepened her faith. Despite the daily physical obstacles that come with living with EB, she has learned to embrace life with courage, grace, and gratitude. As a licensed minister, Alicia finds joy in sharing words of hope and encouragement with others, believing that every person carries within them a wisdom that can lead to healing, growth, and success. Her personal mission is to inspire people to see beyond their struggles and discover the strength that already lives within them. Also with us today, we have the wonderful Dr. David Chu. Dr. Chu is the Chief Medical Officer of Castle Creek Biosciences and has over 20 years of experience in dermatology, academic research, clinical practice, and pharmaceutical development. He previously served as Vice President of Clinical Development at Arcutis Biotherapeutics, where he led clinical programs that supported the approval of multiple indications of Jorvi. I should have asked you, Dr. Chu, how to say that ahead of time, which is a topical non-steroidal therapy for several inflammatory skin diseases. Dr. Chu is also a board-certified dermatologist and fellow of the American Academy of Dermatology. A huge thank you to our speakers for taking the time to join us today. And just one super quick reminder before we start, please remember that this discussion is focused on an investigational therapy that has not been approved by the FDA and is still in clinical trials. Alicia's experiences, which she'll be sharing shortly, are hers alone, and others may not experience the same benefit from participating in the trial. So just wanted to say that. And okay, with that, it is my pleasure to pass it over to Dr. Chu and Alicia.
Wonderful. Thank you so much, Allison. Thanks to EBRP for the opportunity to speak to you all today, to have this conversation. And thank you, of course, for the longstanding partnership between EBRP and Castle Creek. We're very excited today to have this conversation, also to share how far along we've come in our development process. So um, I appreciate the great introduction. It's my pleasure now to welcome Alicia Stewart-Smith. She was actually one of the participants in a previous DeFi trial, and she's generously agreed to speak with all of us today to talk about her experience from participating in the trial. Of course, as you've heard, her story is unique. And her reflections are her own. But we are looking forward to helping her help us understand what trial participation can mean for individuals.
First, thank you, Dr. Chu. Thank you, Dr. Chu. And I want to say a big thank you to Castle Creek and all of the doctors and scientists and everyone that works with Castle Creek for all the amazing work that you all do for the epidermolysis bullosa community. I appreciate all of you. You may hear me say that multiple times throughout this process, because I can't thank you guys enough for the work that you do and the dedication that you have to eradicate such an illness. So I appreciate you.
Thanks, Alicia. I hope that you will also likely be hearing a lot from our end as well, expressing gratitude to you, to the patient community, as well as organizations like EBRP that help to make this possible. So really, really excited and thrilled to be able to have this conversation with you today. So I guess I was wondering if we could just start off by maybe for having you tell us a little bit about your journey with dystrophic EB prior to joining the trial. So, what was that experience like?
Prior to joining the trial, although I had started having an enormous amount of healing by faith and trial and error, multiple types of skincare, some good, some not so good. There's some things that I do still use on a regular basis, but life was really rough because at the time, prior to me getting into the DeFi study, I had a couple of falls, and anyone who knows anyone even with epidermolysis bullosa, you get a fall, it's a whole nightmare. You know, it's a time crunch, and your body starting to heal. It's not like when you have a regular bump or bruise, you fall off a bike. Those things normally with regular skin, it heals within a matter of days. Whereas us, especially having recessive dystrophic, which is really difficult to manage. There was some areas on my body that just were resistant to healing. Like it really, really was. And as I stated before, although I had an enormous amount of healing that occurred as I got older, when I was younger, it was way worse. Everything used to have to be bandaged, head to toe, head to toe. And then when I got in my 40s, that's when I started to see a turnaround. But it was an absolute struggle. I would spend 3 months at a time in the hospital, just ongoing treatments, trying trial and error of every kind of wound care that is probably known to man has probably been on this body. And there's some wonderful things out there. There's some things that just need to go in the trash. That's a conversation for another day.
Yeah, I think that that your experience is probably shared by a lot of people living with EB. I think
Yeah.
in dystrophic EB, as Allison had alluded to, there have been tremendous advancements in and even approved treatments in the last couple of years. Maybe you could let us know what influenced your decision to participate in a clinical trial?
Well, it was two things. One was um, me knowing that there was better treatment out here. There's absolutely better treatment out here than your primary care provider or your basic default dermatologist would even understand or be able to provide for such a unique disorder. So that was rolling around in my head for a while. Like I was searching, absolutely searching for something different, something that wasn't so on the books, if you will, not the regular statistical things that doctors normally are held tight to due to the Hippocratic Oath and the um whatever they're under, like whatever medical team they're under, their hands are held, and there's not really much that they can offer such a patient as myself and many of you that are watching today. So I was on the hunt for something different, something better, something unique to me. And so when I found Castle Creek and I, read about how you would use my cells to help me he tried to become a healed person. That kind of drew me in because it drew me in because of the science behind it. And I'm sure you'll be able to speak on that, Dr. David, in a little bit. But the science behind using my cells, fixing the default, and then reintroducing myself to myself. That's what drew me in. And so I just had to try. I had
Yeah,
to, because there
yeah,
are too many
certainly.
people being born with this illness. And, I want to be a part of the solution.
Yeah.
I want to be a part of that.
Yeah, and it's that kind of attitude toward developing new therapies that helps us to drive innovation, but really depends on participants like yourself to give of yourself. So we really appreciate that. I was wondering if you could describe a little bit what it was like to be part of the clinical trial. When did you kind of what was the experience overall like, and maybe sort of what did you experience with the treatment?
Well, I'm going to start with even just from the beginning, sending out the email and being curious as to how this process was going to be. All of that was kind of eradicated because that's what we're trying to do here, eradicate it. All of my fear was eradicated with the first email. It explained in such detail exactly what was going to happen. It really helped me to calm down and say, okay, I don't have to be so afraid. These are things that I've already had to deal with in my living, such as blood draws, the 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 evasiveness I thought would be much more than it really was. I really did, based on the science and how the science works. I really thought it was going to be more evasive than what it really was. But you guys covered every comfort, every comfort. And I couldn't be more appreciative for that. That every fear that I possibly could have was answered. But the experience for me, I mean, that I went through during that time was once I got over the fear of actually being injected, because that's an added pain. It really wasn't, to me, my experience. It was no worse to me than getting vaccinated, to be honest. I I even though I was um sedated, I really didn't feel any of it, like any of the injections at all. And my experience, I I just was so happy, one, that there's a group of people that cared enough to do such a thing, to focus on us. Um, After I got over that and went and had the first treatment, I realized that I needed to talk more, and I needed to tell people who are struggling with epidermolysis bullosa, look for something different. This is something different. This is something that will give you even more insight on how intricate your specific path, or your child's specific path is in their healing. You hold the keys to your healing, and Castle Creek really helped me realize that with this study. It really
And
did.
so with the DeFi treatment, did you notice any changes with your skin?
Immediately, immediately. And I'm so grateful that I was able to have people accompany me to be able to witness the changes. It felt, the back of my neck, I couldn't even move my head. I couldn't shake my head for a while because it was so broke out that shaking your head was a problem. But yes, immediately in my experience, like that day, it just, my results were, I can't even describe it. You see how I'm struggling to find the appropriate words. I can't even describe how much better I felt, not even 24 hours after receiving each treatment. And even today, I'm still being blessed by the residual effect and I'm not sure whether I got a placebo or not. All I can say is my experience was a little scary at first, but it ended amazing. And the fact, again, I can't express this enough. The fact that you're using your own cells, that for me, it sealed it, because is on every EB patient, in my belief, there's a portion of them that is whole. And I appreciated the fact that you guys really looked into that. And and based on the individuals, and utilize that portion of yourself to help. I appreciated that. That I can't express that. The gratitude I have for the experience. You covered everything. You made me and anyone else that was in the study feel so comfortable throughout the process. I would encourage the parents and any adults to look for something different. And I thank you, Castle Creek, for doing something different.
Thank you so much for sharing that experience. Is there anything else that very, very powerful, and really appreciate your being comfortable enough to share that with the group. Is there anything that you'd want to share with others who may be considering participating in a clinical trial?
I can't say it enough. Look for something different. That is the best alternative. In my experience, I have found that your neighborhood dermatologists, I love them, but when you can tap into a community that is specific to what you're dealing with, you're not going to find that at your neighborhood dermatologist. You're not going to find that unless there's someone there at your neighborhood dermatologist who actually does that, and that's rare to find. So I would encourage everyone to not just take the statistical route, because that's not always the best route. That's not always the best route. We all are individuals. We're different people. We need different things. And there's so much in the world that can help us more than it can hinder us. But we're the fear of finding something different can be scary. That the process of looking for it even can be very scary. And I'm hurting every day as it is. What what do I have to lose? That was really my thought process. What do you have to lose? You're in pain all the time. Lord, I said I wasn't going to cry on this thing, but it's the truth. And I'm having my children are having children now. So I wanted to make sure I did something that mattered so that the next generations of EB people that are born will have something tangible that they can look into and find that could possibly help them.
Well, thank you so much, Alicia, for your generosity, your participation, and your very powerful story.
So much. I appreciate you guys so much for doing the work that you do. Thank you so much, all of you.
Stories like yours remind us why we do the work that we do. So this is wonderful, and so glad to share this with the group.
Thank you.
So, with that as a little bit of context and background, I'd like to share now an overview of where we are with our current phase 3 study. Your cells are science, as Alicia so eloquently put. We are creating a redosable gene therapy using your own cells. So at Castle Creek, we're a regenerative medicine company developing redosable gene therapies. And today I'm going to talk to you about our lead program, which is the D5 cell and gene therapy for the treatment of the wounds of dystrophic EB. We're currently conducting our phase 3 study at 4 clinical sites in the US, and we're recruiting participants both from within the US and outside of the US as well. Excitingly for us, as many of you may know, as a phase 3 study, this is our last clinical trial that we need to complete before we're able to submit our data to FDA for approval. So we're excited to be at this stage. Next, please. So I think this audience well knows that the key role that collagen 7 plays in the problems that are caused in dystrophic epidermolysis bullosa. Lack of collagen 7 protein results in the loss of anchoring fibrils in the skin. And those are the proteins, those are the structures that hold the epidermis and the dermis together. And so the skin becomes very fragile. This can result in a lot of painful skin blistering, a lot of wounding, ultimately scarring, as well as mucosal damage. I'm sure this group knows well the newest approved therapies for dystrophic EB that have taken various strategies to replace collagen 7. And we're taking a different approach with DeFi, in which we use fibroblasts to produce collagen 7 that DEB wounds are missing. So DeFi is made from your own cells. DeFi uses fibroblasts, which are a skin cell type that are the natural collagen factories of the skin. And they're also the most common cell in the dermis, the deeper part of the skin. We use a vector to deliver a corrected copy of the collagen 7 gene into these fibroblasts that are lacking collagen 7. And once we introduce the new gene, the corrected gene, that lasts the lifetime of the fibroblast. We then administer DeFi using intradermal delivery, so small injections that allow us to put collagen exactly where it's needed in order to help wounds heal, and it stays there. Because it is an injected therapy, DeFi can be used in hard to bandage and high mobility areas like elbows and knees, or also sensitive areas like the face. And unlike other currently available gene therapies, it can also be delivered into healed areas of the skin, which may promote extended healing. Next. Next slide, please. So here we have an overview of how DeFi is made. DeFi starts from your own cells, from your own skin. The initial collection is a small skin biopsy, no bigger than the size of a pencil eraser. This one-time procedure will provide enough cells to supply DeFi for decades. So from that initial tissue sample, the fibroblast cells are isolated away from the other skin cells, and then they're expanded in our manufacturing lab. Then a vector is used to introduce a permanent and corrected copy of the collagen 7 gene into your fibroblasts. These genetically corrected cells are then cryopreserved. They're actually frozen down into a cell bank so that each time a dose of DeFi is needed, a small portion of those cells can be thawed out and expanded in just a few weeks to provide a brand new DeFi dose. That then gets shipped to the clinical site or to your dermatologist office. And as I mentioned, that one-time biopsy collection is enough for several decades worth of DeFi therapy. Next. So how is DeFi used to treat wounds? Well, you heard a little bit from Alicia about how that's done. So DeFi is provided as a cell suspension in sort of liquid form. These cells are then injected into the upper part of the dermis with a small needle. And the injections go in a sort of grid-like pattern around the edges of a wound and in the middle of a DEB wound. The needle used is very small. It's the same as size is used for Botox injections. And the number of injections depends on the size and shape of the wound being treated. But it's using this intradermal injection technique that we make sure that the DeFi cells, as well as the collagen 7 that those cells produce, are exactly where they need to be in order to heal these wounds. Next slide, please. So I know that the idea of injections can cause people to be quite a bit nervous. So I wanted to go into more detail into the options for pain management. You heard from Alicia that this is one of the aspects that made her the most uncomfortable when considering joining the study. So we've given this a lot of thought, and we want to emphasize patient comfort during this whole process. So this would be a conversation between you and your study doctor to tailor the treatment of pain management to your needs, but we allow an entire range of anesthesia ranging from topical numbing cream to mild or moderate conscious sedation, all the way to general anesthesia. So Alicia, can you tell us a little bit more about your experience?
Sure. My experience was I did total sedation. The experience was for me, I would sum it up as if you're going to get a colonoscopy. And I'm not sure if you've ever had one, but they offer those types of options from the options range when getting one. For me, I chose total sedation because of the area that was utilized for my injections. Um, as it relates to after I received my injections, and as Dr. Chu said, expressed and explained, the number of injections varies based on the person. I did also I did know that upon my own research. But for me, my injection amount was 60. I know that sounds like a large number. I almost lost I didn't believe that I actually received it because I felt so much better when I was awakened. I just couldn't believe it. However, it's so the injections are so the needle was so small. It was again, I felt better afterwards, that like immediately. And I'm so glad that you showed so many slides about the process, because after I received the injections, it was almost like some sort of magical, mystical situation, because you can see your wound. For me, my experience was I actually watched a wound close, and I thought I was tripping or, imagining, but the people that accompanied me saw it as well. Um, and my suggestion, do something different and do it scared, because what do we have to lose? It was a great experience for me. It was comfortable. The next day, the same day actually, I was able to uh, gently do things around um, the room. I was able to, I wanted to be able to go out, but my body, my common sense said, no, you were sedated. You might want to relax. But the very next day, you can go back to your regular life. I didn't have, it was no bleeding. I've had, if it was very, very little. There was no, it was just no, my experience was wonderful. My experience was absolutely wonderful. I didn't have
That's
any ill effects, but I understand
wonderful.
that varies from my experience. I didn't have any ill effects at all. And
That's definitely what we seek to achieve, to make sure that
yeah,
every patient is comfortable.
yeah.
We've observed that um, numbing cream and mild to moderate
Mm-hmm.
sedation are the most common choice,
Mm-hmm.
but every patient is different,
It's
and
different.
this is a discussion between your study doctor, and yourself about what you think you might need to make sure that we can provide it.
Yes.
So in terms of side effects overall related to DeFi treatment, from our previous studies, we've only seen them related to the local injections, and they've been very infrequent. They've included injection site discoloration, pain, swelling, bleeding, and redness, but very rarely. And based on the observed safety profile that we had from our previous studies, the FDA has allowed us in this phase 3 study to actually double the amount of DeFi that we're using at each visit, and to treat patients down to 2 years old. So on the next slide, I'll go over a little bit about kind of what the study actually looks like. So um, this phase 3 study is a multi-center, so we have multiple sites, intra-subject, randomized and controlled, open label study of D5 for patients with dystrophic EB. That means that intra-subject means that each patient serves as their own control, and the main part of the study is the comparison between two matched wounds, one that receives DeFi treatment and the other that just receives your regular wound care. So if you look at the study schema, the screening phase on the left is what we've been discussing about the biopsy period and manufacturing. At the time of randomization, you'll see that and during the primary treatment period, in one wound, we'll receive 3 doses of D5, 8 weeks apart, whereas the control wound will not be treated. Those are the 2 primary wounds that we follow to determine whether or not D5 is working, how well D5 is working. And at the 6-month period, we assess how much wound healing has occurred between those 2 wounds. Following those initial 3 doses that are 8 weeks apart, there's an optional treatment period where you can receive 3 additional 8-week doses of treatment up through the study duration of 48 weeks. The entry criteria are that you need to have a form of dystrophic EB with a genetically proven COL7 mutation, either recessive or dystrophic. They need to be 2 years or older with at least 2 matched wounds. Although our primary endpoint is looking at those matched wounds at 6 months, the other parts of our study look at the amount of partial healing there is, the speed of healing, impacts on pain, as well as how other wounds that may be treated are doing. So after the primary wound is treated, we actually allow any leftover D5 to be administered into any other DEV wounds on the body. Next slide. So that's really the bulk of it. We've described a little bit about the screening period. We've talked about the treatment period of 48 weeks, where those 2 matched target wounds are receive treatment or not, and controlled. After those first 3 doses, the control wound that was only getting wound care can then start to be treated with D5 during that optional period of 3 treatments afterwards. And then not pictured was a long-term follow-up period that the FDA mandates for all cell and gene therapies. And this is a 15-year period of annual checks to make sure that your health is good after having received the therapy. Next. And so we reviewed some of the eligibility criteria. All the way down to the age of 2, the clinical diagnosis of dystrophic EB with the COL7 genetic mutation, and the 2 wounds so that you have a matched pair to compare. Here I'd want to highlight that if you're receiving other treatments for dystrophic EB, the great news is you can continue them. The only thing that we need is that any other treatment that you use be at least 6 inches away from those 2 main wounds that are under study. Nothing else needs to change. And even better, if you've already been in a D5 study like Alicia has, Castle Creek already has your cells, and you can be screened for this study. You don't need to undergo another procedure. Next slide. And so what type of wounds will be treated? The 2 primary target wounds need to be are matched based on how long they've been around, like how chronic, if they're chronic wounds or acute wounds, where they are on the body, as well as the size. And so the size can vary between 50 square centimeters, which is like the size of a Post-it note, down to about 10 square centimeters, which is about the size of my iPod's case here. So 50 centimeters down to 10 centimeters for anybody who's 6 years or older. And then if you're 2 to 6 years old, the smallest wound can be 5 square centimeters, which is about the size of a quarter. The 2 wounds need to be on the torso, arms, or legs, so not on the hands and feet. And wounds previously treated with D5 can't serve as those primary wounds. But I mentioned that any of the other wounds that are not identified as that primary wound pair can can be treated with anything left over after that primary wound has been treated. And so that can be any wounds that are in the scalp, on the face, neck, hands, and feet, as long as those wounds are not within 6 inches of the primary wound pair. And there are no restrictions on your normal wound care regimen. So we designed the trial this way because we recognize that many advancements have been made in dystrophic EB. We want to make sure that we sort of have a real world idea of how all these treatments might be able to work together. Next slide. A reminder of how we're measuring how well DeFi is working. According to FDA guidance, they want us most importantly to look at complete wound closure. That's 100% healed wound, and the rates of that at week 2 consecutive visits around 6 months. So that would be at weeks 22 and 24, or at weeks 24 and 26. So weeks 22, 24, and 26 become very important for us in terms of determining how well DeFi is working. But overall, we're very interested in, how well are wounds healing, and how is pain being reduced in the treated wound. Next slide. Safety is, of course, of utmost importance in everything we do, including our clinical trials. So we have very strict safety measures in place at each clinic visit. The study doctor asks you about any potential side effects, does an examination of your skin, and vital signs, a little physical exam, as well as checking labs. In between clinic visits, your study doctor also makes phone calls to check in and make sure you're feeling all right. And after treatment is completed, after those first 48 weeks, you still have the continued check-ins every year for a total of 15 years. Next. And so to pull this all together, this is a timeline of what to expect if you were to participate in the study. You'd be asked to visit the research center about 11 times over the course of 15 months. Looking below, the first screening visit would be to obtain the biopsy needed to manufacture D5. After the manufacturing period, around 4 months, you would come for your next study visit for the first treatment. And on the first treatment, it's a 2-day visit. The first day to identify the wounds that will be treated, and then the second day to treat them. That's the one that's a 2-day visit, and then there's a visit 8 weeks after that, and another 8 weeks after that, weeks 8 and 16. And then there's those 3 assessment visits where we look to see, kind of how well DeFi is doing at weeks 22, 24, and 26, followed by those 3 optional study visits for additional injections. And after the optional treatment period, there's the long-term follow-up. And so, we understand that participation in the clinical trial can be very burdensome and disruptive. Our study will pay for travel expenses for you and the caregiver, including airfare and hotel and ground transportation, in order to make it to one of our 4 clinical sites here that are across the US. We have Dr. Peter, these are all EB experts and very experienced in both clinical trials and clinical trials for DEB. In treatment of DEB, this is Dr. Peter Marinkovich up in Northern California at Stanford, Dr. Shireen Guy, who's in Orange County in Southern California, Dr. Anna Bruckner at Colorado Children's, and Dr. Diana Roish at UMass Worcester on the East Coast. So that's a whirlwind tour of our study. You can learn more about both DeFi as the development treatment, as well as our details about the clinical trial and contact information using the QR code that Allison is showing now. These are our study collaborators. I would also like to take the opportunity to thank the most important collaborators, once again, our patients, patient families, as well as patient advocacy groups who are all collaborating, to make these advances possible. Thank you so much.
Fantastic. Thank you so much, Dr. Chu, for that overview and, of course, the amazing, amazing work being done at Castle Creek, and for taking, just the time today to meet with this group. It was incredibly informative. I know I learned a lot. Hopefully everyone on the call did too, especially from you and your direct experience, Alicia. So thank you both so much for sharing. We're going to move on to the Q&A portion of our discussion today. Just as a reminder, pre-submitted questions will be prioritized, but we'll do our best to get to as many questions as we can today. So feel free to keep dropping them in the chat. Firstly, for you, Dr. Chu, I know we saw in the eligibility criteria that this is focused on dystrophic EB. We've gotten a couple questions specifically from the simplex and junctional communities. Just wondering if Castle Creek is looking into other subtypes.
So that's a great question. I think our specific DeFi therapy works best for dystrophic EB because of the cell type that we're using and where the gene defect is. So collagen 7, as of course people know, the defects in the skin layers for EB simplex as well as junctional EB are a little bit higher up in the skin. And so I think our treatment would not be quite as helpful there, although fibroblasts could be considered a gene therapy, a factory for the missing proteins for those as well.
Okay, thank you so much for clarifying. That's really helpful. Alicia, our next question is from you. One of our registrants wanted to ask, what's something that the biotech or pharma companies might not know about EB that you wish they did know?
I wish they did know how expensive it is to take care of this illness. It costs much more than a fixed income, much more than working a 9 to 5. It's very expensive to take care of this illness, and I would that they would take in the cost benefit analysis and put people over paper, if I can say it that way. Humanity matters, and this illness is expensive to take care of. Just for eye drops and creams and things like that, just to take care of the things that happen in your eyes with epidermolysis bullosa can become pretty pricey. And God forbid you get a prescription that your insurance doesn't cover. What do? So I would that they would take a look at the human and what the needs are to take care of a body, of people, and add a little more empathy when they're making their benefit cost analysis and all those things that they do in the board meetings and such. Maybe recruit some people with different types of illnesses to have some real oversight on how they can better, price point things so that they're helping more than they're hindering. Because if people are leaving, they're not benefiting from that. I'm just saying.
No, absolutely. And I know that you're definitely not alone in thinking that. So thank you so much for speaking to it and,
Yeah.
for stating that so beautifully and powerfully. Thank you. It's a really, really valuable perspective. Our next question is back to you, Dr. Chu. One of our registrants was wondering what's next for the DeFi study. A two-part question here. Second part being, when do you expect recruitment to finish and the next steps to begin?
Yeah, that's a great question. Right now, we are actively recruiting. We expect that we'll still be recruiting for a while, so there's still time to join. We're excited for that, as well as for our eventual dosing of our patients, and then the year-long study, so that we can so that we can submit our data to FDA for approval. We're excited for the process, and I think we're making great progress.
That's great to hear. Very exciting for sure. Thank you. And then another question for you as well. Could injections be given to non-wounded skin to perhaps strengthen it against future wounding?
That is an excellent question. It is one that we've given a lot of thought to. Whoever asked that may want a job in clinical development at Castle Creek. This is, I think, one of the real advantages of being able to have to be able to treat already healed skin. That there may be an advantage in prevention um, or durability, and so this trial will start to look at it. That may be the subject of a dedicated clinical trial in the future.
Yeah, that makes sense. Okay, thank you so much. And then I did see we have time for another question in the chat here from Stephen. He's wondering, besides wound healing, will the trial address the treatment of fused digits?
Mm.
Yeah, that's a great question too. I mean, fused digits, are a very devastating sequela of of the wounds associated with dystrophic EB. I think this ties in nicely with the previous question that I think if we were to intervene early enough in terms of either preventing or healing up wounds, we may be able to help prevent that from happening. But in terms of the actual treatment of that, that is not something that we'd be addressing in the trial.
Got it. Okay, thank you so much for answering. If anyone else has any questions that they didn't submit when you RSVP'd or anything that popped in your head, feel free to keep dropping things in the chat or to send our team an email at info@abresearch.org, and we can always get back to you with an answer after the fact. But with that, thank you so much, Dr. Chu, Alicia, and all of our attendees for participating. I'd like just again for compliance to remind everyone that Alicia's experiences were hers alone. Participating in one of these trials does not guarantee that you or your loved one will experience any benefit, of course, other than helping Castle Creek advance the science in the field. So just to wrap up, how can everyone on this call take action to support our unstoppable EB community and accelerate EBRP's mission? We have a couple ways. The first is something that I alluded to earlier. EBRP and our scientific advisory board are currently reviewing some really exciting and innovative research projects, and we want to fund as many of them as possible, the most impactful, the most highly rated projects as possible. But we honestly can't do it without your support. So if you're able to, please consider making a tax-deductible donation to support our work. And thank you, Margot, for dropping all of our links in the chat there. You can find out more
Mm.
information on how to support in the chat. And if you're looking for a way to amplify that impact and support promising research on an ongoing basis, we'd also love for you to consider joining The Effect, which is EBRP's monthly giving program. For the cost of as little as a cup of coffee every month, you not only directly support the research that we want to fund, but you also get exclusive early access to events and dedicated updates and stories, as well as merchandise discounts in our online store, some really fun stuff there, and more. So you can click the link in the chat if you want to learn more. And then lastly, be sure to also follow EBRP on social media and to sign up for our newsletter to stay on top of exciting updates in this space, to meet members of our amazing community, and to learn about upcoming events and more. Thank you so much again, everyone, for taking the time to join us today and to learn from our truly brilliant speakers. I cannot thank you both enough, Dr. Chu and Alicia, for being here today. We hope
Thank you for
to
having me.
see you next
Thank you
time.
for the opportunity.
Thank you so much. Have a great night, everyone.